You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's a hot topic. We're talking about the end of a possible end to hair transplant surgery. And we're hearing it from, one of the world's pioneers, leaders in hair transplant surgery, Dr. James DeYarman. Dr. DeYarman, welcome to the program.
Thank you.
That's a bold statement. I know you still do surgery, hair transplant surgery. You've got like one of the only robots, the artist robots, here in San Diego, is that right?
Yes.
But you're excited about something. So excited, you talked me into it too. And now my hair is thicker than it's been in years. So I want to thank you for that. And it's with stem cells. So for people that don't know you though, tell us about your practice in La Jolla.
Well, I've been doing hair transplants for almost 40 years in San Diego. And when I started out, there were just 3 of us. Now today, there's probably close to 100 people doing hair restoration. So I'm always trying to find what's the latest and the best. And I got my rep from the artist showed me this picture of this guy that had done stem cell transplants from adipose tissue.
Okay, how many years ago was this?
It was in 2016.
So the actual robot, the artist robot rep, the hair transplant rep, tells you about stem cells.
Yes.
So what happened?
Well, I found out about it. I talked to the doctor, found out where he got trained and what the whole process was. So I went and found this company in Orange County, and they sent me off to be trained by this plastic surgeon.
Okay.
In western Montana. And I just couldn't believe it. But that's where he was my age.
Montana? Are they busy over there?
His clinic was unbelievable. We were at least 30 miles west of Missoula, and there's not much out there. And I walk in there, and the place was packed. There was people in there getting IV stem cells, injections, doing all this stuff with stem cells. And it's all patient referral. They were from all over the world coming in there. It was unbelievable. So I learned how to do the liposuction of the fat.
So getting stem cells from the
patient's fat. Patient's own adipose tissue or fat. And from there we would process it, and we ended up with these, what we call mesenchymal stem cells, which are the best kind for, hair regrowth.
And injecting those right into the head.
Exactly.
And it worked.
Well, yeah. Did it ever? I mean, I had patients, I got the one of them that came in after 3 months. He was completely bald and full head of hair.
Is that right?
Yeah,
okay.
yeah. I have the other one that I thought was this one that I show you right here.
Yeah.
And it showed how you shouldn't transplant a man under 30 years of age, because you're doing more of a disservice than helping him, because he can't look 18 all his life. He'll run out of hair.
Okay.
It's just a matter of time. So if you can just take this 20-year-old, and they're the most, it's amazing. Of all the age groups you see more age of the 20 to 30 than any other group.
So 20 to 30, they're losing their hair.
Yeah, and they can't.
Instead of a transplant, inject them with stem cells.
Exactly.
Stop it, grow new hair.
Yeah, and also I have them use a laser cap. The two of them together is a nice combination. And I stumbled into that.
The laser cap.
Yeah. The guy.
I wear one.
Yeah.
I've got yours. You can't get it on Amazon. You can't buy it anywhere. I guess it has like probably 10 times the
number of diodes.
The diodes.
Yeah, and so they make it so that you can only get it through a doctor's office. But I wasn't really a believer of it until this patient that I did this procedure on, and I talked about him in England and Manchester at the meeting that I presented this patient. And as I was preparing for the talk, I called him up just to go over and make sure I got everything right. And I said, you came to me, you were on Propecia minoxidil, right? And I injected the stem cells, right? Yeah, and you grew all this hair up in three months, right? Yeah. I said, by the way, did you ever try a laser cap? Oh, I bought one a week before you did the stem cells. And he didn't even tell me.
Okay.
But I said, well, that's what it is. Because they both work on what we call the miniaturized hairs. They're little thin hairs, and you can see it under magnification. So when doing the transplant, or doing the stem cell transplant from fat, the FDA comes along and says, we're breaking the law. We're creating a drug. Because we would take the fat cells from the patient and combine it with human enzyme to extract all the cells.
And then spin it like in a spinning machine.
Yeah, centrifuge.
And then inject it in the head.
Yep.
It was working, but the FDA said no.
No, you can't do that. You can't
Okay.
do that. So we started looking for other sources of stem cells. There's amniotic fluid, there's cord blood, and there's bone marrow.
Okay.
Now, I don't know if you've ever had a bone marrow, but that's no fun to go through.
You had it.
Yeah, I did, but it worked.
Okay.
It worked, but it was very painful. Where when with the cord blood or the cord tissue that we're using now, it comes to us in a vial that we can just draw into our syringes and inject in the scalp. And it's so easy to do, and it's not painful, and the results are amazing.
I know somebody, by the way, that's injecting the fat stem cells into their head. They're in the medical profession, and the results are really not so good. Because I told him, I said, look, Dr. DeYarman injected me, and literally it was 2 months ago. I have you can't really see it, but I have all new growth, all fuzz, and now they're turning more and more. People think I dye my hair. I don't dye my hair. I'm half Mexican, so we all have black hair in my family. But I got nothing but brand new fuzz all over. And the back, which I never even thought about, is completely filled in now.
Yeah, I know.
Which we have photos to prove that.
Yeah, we showed that. And what amazes me is that when I presented this case at the convention in Manchester, England, a lot of the guys didn't like it because it really disappointing, because it's like they're more interested in making money than they are doing the right thing for the patient.
Okay.
And I was really shocked, but it's the way of the profession.
I was in your office when I was getting this done. You say, Randy, you're a slam dunk all day long. I'm paraphrasing you slightly, but you said, you're a slam dunk hair transplant case. You'd like a little bit more hair. You're easy, but it's not best for you.
Exactly.
You said you need to do the stem cells. And it was actually, I was a little bummed out. I'm thinking, it'd be easier just to get, quick, no downtime, blah, blah, blah. You did this, and now I already want to do it again. It's only 2.5 months later, right? But it's like so noticeable that you grow new hair.
Yeah. Yeah, and it's going to continue to get better, Randy.
Yeah, you say about every 9 months.
You could do it.
I can get it done. I may secretly go behind your back, but let's talk about your stem cells, because not all stem cells are created equal. I mean, they die, right?
Yeah.
So this company you use, because I had another doctor breaking into the business in actually Colorado, and they said, I said, I'm getting growth. It's only been a month, because I saw it right away. They go, what? That's impossible. But they're using PRP. They're not using the real thing,
not the same
like
thing.
what you're doing.
PRP stands for Platelet-Rich Plasma. It was developed by a dentist to promote healing.
Okay.
Well, platelets have nothing to do with hair growth. It says platelet-rich plasma. In the plasma, there are some stem cells and some what we call exosomes.
Those are growth factors, or no?
Exactly.
Okay.
Growth factors. And see, the exosomes are produced by the stem cells. They're little vesicles that are particles. And within those particles is the messenger RNA and the transport RNA. They're the pipeline between the stem cell and the cell or the tissue you're trying to repair.
So you've tried PRP, just didn't work very well.
Oh, I'll never forget PRP. I was one of the first guys in San Diego to do it. And the first patient I did, I couldn't believe it. We got a pretty good result.
Okay.
After that, nothing. It didn't seem to mount. It seemed to help a lot with surgery to help the patients heal faster.
Yeah.
But not the growth that I've seen with stem cells. I mean, stem cell therapy.
So you buy a kit, just so we're clear, and we're talking about the end possibly of most hair transplants, to regrow hair with stem cells, injecting it right in your head. Didn't hurt me at all. I mean, literally, you numb me up, I didn't feel a thing.
Yeah.
But there's a kit. You get this kit.
Right.
And tell me about it.
Well, they get these stem cells now from they call it cord tissue and placenta.
Okay.
And the cord blood.
Umbilical cords.
Right.
Right. Okay.
Right. They're fetal stem cells, basically what they are. And I always get the question, can I take these? Yes, these stem cells, you can give yours to anybody else, and it wouldn't be any matter. In fact, they were trying to do that with fat, create these fat banks, and get an endless supply of stem cells. But anyway, take the kit that we get, and we thaw it out, and you got to use it within 20 minutes.
Okay.
So we try to time it very, we first numb you up, and then next thing I do, I microneedle the scalp. The reason for that is the microneedling creates inflammation, and it draws the stem cells right up there. So they're going to stay where you want them to be.
So you were doing little punctures
Exactly.
on my head first, then you injected
That's right.
the cord stem cells. And yeah, I mean, I saw growth right away. I wasn't imagining it.
Well, when I was asked to talk about this in England, I made my discovery the month before I did the meeting there. That's when I found out from the patient he'd used the cap. Well, I had this attorney patient of mine come in. He wanted me to transplant him right in the mid-scalp. And I've done the frontal work on him, but he's starting to lose back here. And I said to him, before we do this, let's try these stem cells. I said, I think you'll...
Which is a lot less expensive, by the way.
Oh my gosh,
lot less.
and a lot easier to go through. No downtime.
Like 80% less cost, yeah.
So we did. And I said, I know I can prove in a month that was effective. And the way I did it was when you come to the office, I take the video microscope and we look at your hairs and we see these thinning hairs. And we'll go back to that same area after a month and you'll see them all
They're thick. You showed me that on mine.
Yeah.
I had little tiny baby hairs and now they're thick like regular hairs.
And that's so important, Randy, because people want to think they're not throwing away their money, that it's not a legitimate thing to do. But when you can show them in 30 days that their hairs are getting thicker, oh my gosh, it makes it all better for everybody.
So this has changed everything for you. In fact, I was sitting in your office because we were doing a follow-up after you injected my head with stem cells. And you said, this is like so exciting to me. It's like not reinvigorated, but it's like you got a second wind now because you've been doing hair for 40 years.
Yes.
So this is like, to you now, like a brand new career.
It's
almost.
the best thing that's ever happened to me, Randy.
Really?
Yes, because for the first time, if there's any side effects from stem cell injections, they're positive.
Yeah.
Positive. I had a man that had shingles, had severe pain from his nerves, I did a hair transplant and injected stem cells. The next day, he called me up and says, you're a miracle. I said, what do you mean? He said, my pain, no more facial pain. Well, what happened was stem cells will migrate towards inflammation. And it went right down, migrated from his head right down to his cell.
Is that right? So people that you would have done a hair transplant on just 5 years ago, you're talking out of.
Oh, absolutely.
And saying do the stem cells.
I think that
because of the results, right? It's not about the money so much anymore for you. Is that fair to say?
Well, yes, it's more important to have happy patients. And I get such a good feeling of seeing these people really appreciating what you're doing for them. Where in hair transplant surgery, it's always they want more.
You said everybody wants more. Just like I'm in your office and I'm going, when can I do it again?
Yeah.
You said, just wait about 9 months, right?
Yeah, I mean, it's a good question though. How long will it last? I was told and I was taught that you can figure about 2 years. But if you add the laser cap to it, it could be a long time.
Because you're doing a combination. Look, you've got a laser there that's the leading laser on the market. Mm-hmm. You can't buy it on Amazon. You got to buy it through a physician.
Right.
So you got the laser, maybe possibly medical therapy, topical solutions, and the stem cells. You could end baldness. You could end people losing their hair. Is that possible, you think?
I don't know.
Like if you could, because you can't prove it yet, right?
No.
But if you got a 20-year-old that was losing their hair in a rapid phase.
By far, you would help that person the most.
Do you, in your opinion, again, because again, stem cells are all new. I'm trying to get you to say this, right? And I know the kind of guy you are, you're not going to exaggerate. But are you of the belief that you could probably stop them in their tracks of hair loss? In their 20s and 25?
Absolutely.
Well, that's big.
I know. And it's the 20-year-olds that all these clinics prey on. They'd say, because they always want a quick fix. And they always want to lower their hairline. And you end up creating.
They'll pay you anything.
Exactly.
Look, and this is what people need to know, because it's like I'm endorsing you because I've had it done myself, and my hair is like better than it's been in years. But the way, if you get a 20-year-old, because you've explained this to me in your office, you get a 25-year-old, they want to do it like yesterday. You do it, but the problem is, 5 years later, you're 30 before you know it, and now you look like you have plugs. But now you look like you have fake hair.
Is that
true?
Wrong. There's something not right.
Because they continue to lose their hair.
Yeah, exactly.
But it's thick just where you put the transplant.
Exactly.
You don't like doing it that way anymore.
No. In fact, I won't do a transplant unless without a stem cell at the same time. Because if a guy wants a transplant, I want to keep all the other hairs in the area, and they'll continue to grow. The miniaturized hairs will come back, and you look like a lot better. You get a lot better result.
Okay, good.
But
You know, but before we start, we got to talk a little bit about your background. You have an unusual hair background. I mean, you get out of medical school, practice for about a year, I think, and then you get into hair transplant.
No, it's longer than that.
Is that right?
Yeah.
What happened? You were in practice a lot, 3 years? 5 years?
Well, I started practicing in 1974.
Okay.
And I opened the hair transplant clinic in 1980.
Okay.
But when I was doing my internship, I saw the first hair transplant. And the doctor that taught me had us as interns. We could go over and watch him do a hair transplant in a barber shop.
Isn't that right?
Believe it? Yeah. Yeah, and it was all, and there were no gloves worn back then. It was called a clean hand surgery. And I can remember we used to do transplants. We never wore gloves because the grass would stick to the gloves. Well, then AIDS came in. That's when it all changed.
Yeah. Yeah.
And now, God, I can't imagine doing it without gloves.
Okay, stem cells to prevent hair loss, stop hair loss, and grow new hair. You brought photos. Let's take a look at some of these photos.
Okay, well, this one I think is the key.
Okay, this is just stem cells.
That's before, and here he is 1 year later.
But somebody could argue and say, well, with this photo, he just grew his hair a little longer.
You could argue that, but with the balding pattern, those all are miniaturized hairs. They won't grow near as fast or near as long as your other hair.
Yeah.
So,
you know, ever since you injected me with stem cells, the front of my hair wasn't growing. It like stopped, right? It might have grown a little bit. Mm-hmm. So I go in to get a haircut, and she's even saying, your hair's thicker. Something's going on. What are you doing? Because she thinks I'm gullible and do all these crazy things. But she goes, this is obviously working. It is a big difference. People can. So this guy, this is just stem cell. And did he come in for a hair transplant?
No, he came. He was 30 years old.
Okay.
And he heard about stem cells, and he came to me, and I said, yeah, I think that's a smart thing for you to do. Okay, you have to look at the whole picture here.
Okay.
Because when you photograph people, not only the front view, but the top view and the profiles.
Okay.
And that's where you really prove it here, because if you notice how much recession he had when he started out, and how it starts filling, and finally.
So that profile shot is dramatic.
Exactly.
It grew in.
Well, it's
and
obvious.
that's just stem cells.
That's just stem cells.
Now let's look at the front view.
Same thing. Each time they get better. That's what's amazing. I just can't get over it. It's so exciting and so much fun now that I think it's the greatest thing that's in sliced bread.
Do you think it'll ever get to the point where, because you have a robot.
Yeah. Oh yeah.
And you now hardly ever use the robot.
Yeah, I've had it all. I've always tried to do everything.
You're always trying to figure it out.
Yes. Never accept that we finally figured it out. I learned that about 20 years ago.
And it all led you to stem cells.
So
this is like the new thing. Look, a lot of guys are dabbling in this, right? We were talking in the green room. You've been doing this for 40 years. There's probably not a lot of guys that have done it longer than 40 years, right?
Probably not.
You're probably in the top 1% of most experienced.
Yeah.
So there's a lot of people. Look, I know plastic surgeons, I have them on the show, and a lot of them are dabbling in hair transplant, dabbling in stem cells. And you've explained to me many times that there's more to it, right, than that. You have to kind of like peek into the future and see where they're going, and that requires judgment and experience.
Training.
So
really.
Does it bother you when guys think they can do it and it's easy, and it's really not that easy, you say?
It's not, and to give you an example, I've gone to conferences now, and we're talking about it, and one doctor was talking about how he injects vertically. You can't do that, because you want the stem cells in the dermis, which is between the epidermis and the subcular fat. If you go vertically, you're going to go through it, and you're probably going to put all the stem cells down the adipose or fat tissue.
Okay.
And they're not going to do near as good, because where the growth is in the dermis. So you got to inject horizontally. And you inject, now I was taught this, to inject only 1/10 of a cc every centimeter. So I put the needle all the way in, and as I pull it out, I just watch my syringe, and 1/10, and then I just keep doing it, every centimeter. And then I spread it all out. And a lot of guys will think, well, more stem cells would be better. Not really, because if you try to inject too many stem cells in one area, they'll clump, and they won't be very effective. So you want to try to spread it out as much, because they'll migrate.
Okay.
They'll migrate all over the body. It's amazing.
Let's talk about hair for a minute. You say it makes you look younger. It's great for the self-esteem. And, we notice in Hollywood, the leading men all have hair.
Yes.
knowing you're coming in, I was, watching some movies. I'm going, every one of these guys has hair. And a lot of these guys have fake hair. They, even though bald or shaved heads are, in fashion right now, but some guys are really bothered by it. So who's this for? Somebody just bothered by it, tormented by it, always wearing a hat?
Well, I think it's for the guy that's concerned about his hair loss. And I never met anybody that when he's 20 years old, look in the mirror and say, oh, good, I'm finally losing my hair. And that's what I'm trying to reach out to, is that those guys that are less than 30 years of age, don't do a hair transplant. Do this first.
Stem cells,
Yeah,
real
absolutely.
stem cells.
Yeah, absolutely. And everybody is much happier. Because if you do a transplant, you just create a surgical cripple.
Okay, so start early, maybe get some stem cells. Guys in their 40s, 50s, because even people that had thick hair their whole lives, like to me, it didn't hit me till I was about 42 years old, and all of a sudden my hair is falling out on the pillow and the sink.
The first thing we do with anybody that's got just minimal hair loss in their 40s, well, we'd start them on stem cells. If it's severe loss, then we probably do a combination of transplants with stem cells.
Okay.
It did depend. You have to look at each patient and their age, what their expectations are, how big their head is, what do you think their balding pattern is going to end up like. You can really much.
So there's an art to this.
Oh yeah,
Okay,
experience. That's the key.
Okay.
Knowing what to look for, knowing what to expect. That's what.
And not all stem cell companies are the same.
Oh no, In fact,
That means that the stem cells you're using to grow back your hair, if you're going to a practitioner, they've got to be using the real stuff, the good stuff.
well, the stem cell market is growing very rapidly, and it's because I was told the other day there's like over 100 applications into the FDA for all these uses that people are seeing they can do this with, and it's going to change medicine a lot. I mean, we're just seeing the tip of the iceberg here. There's a company, I think right here in San Diego, that's now trying to culture stem cells in the lab.
Okay.
And eventually they're going to probably culture hair out of it.
Guys that don't want to lose, I'm going to switch subjects for a second, but guys that are losing their hair, right?
Yeah.
We're always looking for a quick fix. I feel like I'm kind of in the know because I get to talk to guys like you, pioneers in this industry. But hair, because I Googled you, wanted to find out a little more information about you and some of your Instagram stuff and Facebook stuff, I'm now being marketed by all these quick fix, like all these hair transplant systems, like this new cream, this new oil, this new pill. But really there is nothing that new other than stem cells.
That's right.
And Rogaine or Propecia and laser caps, I mean, that's pretty much the best right now you guys have to offer.
Exactly.
So be careful then on these gimmicky things.
Well, I think the thing that bothers me the most is that I see them like, I don't know much the name, but these companies advertising on TV that you get these kits, and in these kits is Propecia or finasteride, and there's some serious side effects there that the people aren't aware of.
So if you take one of these pills, the package insert says it could cause impotence. Mm-hmm. And nobody wants that, obviously. And in some cases, if you read it, it could be permanent. Mm-hmm. You don't get it back.
That's right.
So you're not a fan, really, of these pills.
No, I'm not, because when it first came out, we were told that only 2% have a side effects, and they're minimal. Just maybe a decrease in your sex drive, or some decrease in the amount of semen you produce, things like that. Well, it turned out there's more than 2%, and they always said if they stopped the medicine, the symptoms would go away. Well, some cases they haven't.
Just not the case. But you believe with stem cells and the laser cap.
Safest thing you can do.
And it works.
And it works, and you get positive side effects. That's what I like about it. Side effects, everything has a side effect, but stem cells has a good side effect.
You'd make a lot more money doing a hair transplant on a 25-year-old than you would just giving him a stem cell treatment.
Is that true? That's right. I'll give you an example. This guy here, most people in my industry would transplant him. And he's at least a 4,000 graft case. Okay. 4,000 grafts. And for robotic, it was $7 a graft. I just figure the numbers out there. See, that's a big chunk.
So you have more photos. What else are we looking at?
This was my first positive result from stem cells.
Okay.
And it was in 2000.
So that's a before.
This was his before.
Okay.
And this,
It's got pretty good hair right there.
but this
I
is,
guess the front, you could see through it.
yeah, and this is 3 months later.
Wow. This is kind of like what's happening to me.
Exactly.
I mean, I'm noticing it.
Exactly.
Like it just fills right in.
Yeah, yeah.
So guys know what I'm talking about, right? You're able to see through your hair.
2 places guys will lose their hair: in the front and the crown. I call that the 7-Eleven spot.
Okay.
You know, you go into 7-Eleven and look at the monitor.
can see it.
Who's that bald guy?
Okay.
You know, it's you. But those are the 2 areas you treat, and it's the safest thing you can do today to help people, and it works.
It works. I mean, that's the
works.
name of the game. But that's the challenge, right? They don't know whether they believe it.
Exactly. That's why I like to bring them back in a month and prove it to them with a video microscope. Say,
Well, you could see it. I mean, I could see it. I didn't need any magnification device.
you know that
I
guy.
mean, I could absolutely see it coming in. I mean, I don't know what that size is, maybe half an inch. My hairline is dropped down.
Yeah.
You say it's just going to get better and better.
Oh, absolutely.
And I was trying to kind of talk you into doing it again.
No, not yet.
You said, please wait.
Because you want to give it the whole cycles to go through and work out. And then if we want, I was taught wait at least 9 months and then
Okay.
do it again. There's
So when
some
my hair-
doctors that inject more.
Now, when my hair gets thicker, am I going to be running and hiking and canoeing? You know, like you see those commercials, guy gets his hair back and he's like traveling the world and at Machu Picchu. I guess that's next for me,
Oh,
right?
yeah. I think you'd be a movie
That's
star.
the most expensive part about this is you get your hair back and you start traveling,
Yeah.
having a good time. It is good though, because you feel younger. You start feeling old when your hair's falling out, So, well, good for you. Now, we're going to have your practice manager on the show, who is also your daughter.
That's right.
And I've talked to her, and I wanted to get her perspective because sometimes, talking to you, the results, it sounds like you're exaggerating. But now I've experienced it, so I don't think that. But she says we see transformations every single day in our practice. So, final message. Somebody, they're losing their hair. Or maybe their son or daughter or son is losing their hair. This is they're in college. People will do anything for their kids, right? Mm-hmm. And they know their son is bothered by their hair loss in their 20s and 30s. You think stem cells?
That would be the greatest gift they could give to this child, because you're not going to hurt him, you're only going to help him. And if you could stop his hair loss, if you can just stop it, that's a plus, And he's not ready for hair loss at that age. And so he's very vulnerable to hair transplants.
So these laser caps work, but they're different.
Yeah.
You can't, but I had the older laser cap. You had to wear it 26 minutes every other day. Mm-hmm. The one you got me, which has about 10 times the lasers, 6 minutes.
Yeah.
That's it. I did it this morning.
Yeah. Yeah, it's a really nice setup they got, and
You say you're sold out. It's hard for you to get them.
yeah, we're back ordered. And they're assembled in Miami.
Is that right? So you're just getting more and more and more. Okay. So final message, the guy watching this, he is really miserable about his hair, doesn't know what to do. What do you say?
Call me up, come in for a free consultation.
Okay, good. And they get to see
really
you.
it's the best way to evaluate the hair loss, because you can look at it under magnification, and we take photos that you'd never take, of where we wet your hair down and really can see the balding pattern. And then we examine the hairs, and you'll know what you got, and then you can follow it yourself too.
Yeah, you could see a difference. I was actually getting a suit at Nordstrom, and the mirrors, because I never look at the back of my head, and I'm looking at the back of my head and I'm going, oh my God, this is really a big deal. I almost called you while the tailor is taking care of this, because I couldn't believe it.
Yeah.
So it is stem cells. In fact, all my circle of friends now, the doctors, they're going, people think doctors know everything, but these are plastic surgeons, dermatologists that are all going, what's the company he's using? We're not seeing those kind of results. So Dr. DeYarman, always a pleasure to have you on the show.
Thank you very much.
Up next, we're going to talk to his treatment care coordinator, office manager, that is going to put her 2 cents in about stem cells. We'll be right back. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, stem cells for hair growth. I had the procedure. I love it. Without exaggeration, we've shown my before and after programs pictures on the show. Dr. DeYarman in La Jolla, California. And I was even considering a hair transplant. and Dr. DeYarman literally talked me out of it. Now we have his treatment care coordinator. She meets the patients every single day. And I wanted to get her take on stem cell treatments. So Nicole Johnson, welcome to the program.
Thank you for having me, Randy.
Good. Now, so you've been doing this 20 years in
Yes.
Dr. DeYarman's office.
I have literally grown up in the hair transplant industry.
Right. Okay. So you could talk for hours on this topic.
Yes, I can.
Now, in the old days, which was, a couple months ago, that he was using the robot. He was doing a lot of hair transplants. And now, people that he would have transplanted, now he's doing the less expensive, less invasive stem cells. So I'm going to ask you, what kind of results are you seeing? And you were skeptical, you said too.
We're seeing results very quickly. I mean, I was shocked, quite frankly, at how fast they're happening and how consistent they are. I mean, every single person has had great results. And what's so exciting is, especially for our female patients who oftentimes just weren't candidates, and they'd be in tears, and we'd have to be honest with them, just saying, there's really nothing we can do for you. And now we can. And
So the women are getting results with this.
Oh, absolutely. It's life-changing for them, because as a man, you know that it's a possibility that you may lose your hair, but as a woman, you don't think it's ever going to happen to you. And when it does, it's devastating, and it's changing people's lives for the better.
So when I see women in their 50s, 60s, 70s experiencing hair loss, I notice it. Are they candidates, or are they too
Absolutely.
old for this?
No, stem cell does not discriminate. Everyone is a candidate, and that's what's just so exciting. So we're able to get stem cells in their purest form.
So you say that they get their hair back with stem cells and they act differently, like their self-esteem has changed.
Oh.
Like, what do you see?
Absolutely. I mean, especially, well, with the female patients, they come in wearing a hat. They've really lost their confidence. They feel like they're not even a woman, so to speak, or they're less of a woman. And by bringing that back, it just changes their lives completely. And it brings us such gratification and joy knowing that we can offer that.
Now, I noticed my hair growing back. It came down, I'd say, about a half an inch in the front. I saw it within 3 weeks. I mean, you could see it. Is that typical?
It's not uncommon at all, because the stem cells immediately start to reverse the miniaturization of the hairs that are starting to weaken. And I found, especially with the female patients that wear their hair long, they were noticing a lot of breakage, and people kept asking, are you getting your hair cut? And they weren't. In fact, they weren't cutting their hair at all. And that's the first thing they were noticing, is that their hair was finally starting to grow again. And
does it make it thicker?
well, yes, if the hairs are miniaturizing, they're going to become thin and weak until they ultimately fall out. So by reversing that process, you're getting them back to their original state. So yes, they become thick and viable and just healthy, beautiful hair again.
Well, the front of my hair was like baby hairs, like very thin.
Right.
And I've noticed in literally just 2 months, they're thicker. And he showed me under microscope, they are thicker. And he proved it. And these are stem cells from the umbilical cord.
Correct,
right?
from the connective tissue of the umbilical
It's
cord.
not PRF or fat derived from liposuction.
Correct.
And you believe that this is like the best way to go.
Oh, absolutely.
So what is your final message? Somebody that's losing their hair, a woman, a man, what do you say?
Well,
And they're bothered by their hair loss.
right. Just come in and talk to us. We are a family-run business. There's no high pressure. We're here just to listen and educate you, and you can make the decision on really what's best for you. But I know at the end of the day, we're definitely changing people's lives in the most positive way possible. And nothing can feel better than that.
Do you find yourself in your personal life telling everybody about stem cells as well for hair?
It's a sensitive subject. So if people are willing to open up and talk to me, then absolutely. I'm educating everyone I know if it's an issue for them. And I have friends that have had it done, and they are just thrilled.
Okay, good. Well, look, I want to thank you, Nicole, for coming on the program. And if somebody wants to know more, they could call your office. They could actually talk to you. Is that correct?
Absolutely.
And they see you on the consult sometimes?
Yes.
Or all the time?
Almost every time, yes.
Okay, good. All right, Nicole, thanks for coming on the program.
Thank you for having me.
All right, you've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.